if your patients can't wear Invisalign for 22 hours a day, we tell patients you have to wear Invisalign for 22 hours a day. 22 hours a day means only 2 hours are available. Patients can take out the tray for only 2 hours a day. That's too little. Or what about French people? They eat dinner for 2 hours. Gemini said that. So French people cannot get treated with Invisalign. What about Koreans? Everything is fast here. For us, breakfast takes 5 minutes, lunch 5 minutes, and dinner 20 minutes. So within an hour, mealtime is over. So don't we have a problem wearing Invisalign? Not really. There are temptations here. Lots of warm ones snacks many times a day. Workers routinely go out and enjoy smoking and talking with co-workers. During those times, patients cannot wear Invisalign trays. Students also have challenges. They usually don't brush their teeth after lunch at school, so they don't want to wear Invisalign trays after lunch until they get home. Many of them may wear the trays for less than 18 hours a day. What happens if they don't wear the trays enough? The trays may not sit all the way. You will see a gap between the plastic and the enamel. It may be okay for simple cases. If you find this at monthly appointment, you can slow down the treatment. If the gap is slight, it can be corrected. Let the patient wear the tray longer and let them use the tray 20 minutes a day. If an ill-fitting area has an attachment and the discrepancy is too much, remove the attachment and let them wear the crown tray for 2 weeks or 3 weeks or even a month. Or let them go back to previous trays 1 or 2 steps before the current one. For more complex cases, such as an extraction case, patients should wear the tray for 22 hours a day. If they don't, you can see side effects easily. Canines, premolars, and first molars are intruded. First molars and premolars tips medially, and canines tips distally. Once you have the bowing effect, recovery is difficult with Invisalign. I personally prefer switching to fixed appliances at this time. Among my Invisalign and other clear aligner patients, the worst were high schoolers. They failed more often than adults. They chose Invisalign because they didn't want to show braces. Besides, they didn't pay. Their parents paid. So some of them didn't realize how much their mom and dad sacrificed. The 22-hour rule has exceptions. Children can wear Invisalign less. At this age, treatment may go smoothly even if they don't wear the trays at school and just wear them at home. Their alveolar bone is soft and teeth move rapidly due to the growth hormone. In addition, kids listen to their mom and doctors more than adolescents. If your patients are not children and the case is not simple, make sure your patients wear the tray 22 hours a day.